Hello everybody, welcome to the fourth interview of ePatients in Europe. I have the great pleasure to interview Angel Gonzalez today. Angel leads Idea Agoras, a very well-known online community on social media in Spain. It might come as a surprise to many of you that I'm interviewing him here today as a patient because it's not very well known that Angel also was diagnosed and is suffering from a rather rare disease. So Angel, please tell us more about your diagnosis of your disease and how all of a sudden being an e-patient, having evangelized about social media, has helped you cope with it.
Hello, Silvia. Thank you so much for inviting me to participate at your blog. And this time, not to talk about Ideagoras, not to address my thinking about social media in healthcare in Spain, but to share with all you my experience as an e-patient. Yes, as you said before, I was diagnosed, that was at September 2009, with a rare disease called hemochromatosis. As many of you know, hemochromatosis has to do with excess of iron on blood. At that point in time, when I was diagnosed, I had a threshold of 1,500 points of iron on blood, which was really warning. and after passing an echography of the liver just to know if I had any kind of damage, because for your information, once the iron affects the liver, that used to lead into a kind of cirrhosis, I began to go into the treatment. And the only treatment that exists up to now, it has to do with taking away blood. And this is what the scientific literature states, because there is no kind of drug nowadays in the market to struggle against this disease. And it was really tough to go through the treatment, because I began to go to the hospital at September 2009, and during all the winter and the spring of 2010, for over 6 months, I went to the hospital once a week, and half a liter of blood was taken away of my body in order to combat the disease and to try to drop the levels of iron on blood. And thank God, at April of 2010, that horrible threshold of 1,500 points of iron on blood was controlled, getting down to 35, for just 35 points, which is good, because that threshold is what the scientific literature states as a good level. And from that point on till now, I'm just testing from time to time how that iron blood is evolving, and up to now I'm fine. But this means to be controlled for the rest of my life. And if I pass the level of iron on blood recommended, I will have to keep taking away blood of my body from time to time.
Angel, I was very intrigued by your use of patients like me. You said that there wasn't much information in Spain, so you went to the American internet, which is something we've seen in other interviews happen as well. What was your experience with patients like me? And as a social media expert, do you think that there is a chance for patients like me to exist in Europe as well? Or is this basically a US concept that culturally would not work in Europe? What is your stake on that?
Patients like me was my final social platform to try to find healing through the social web. That is true, because when I was diagnosed, I went to the web. I went to the search engines, and most of the information I found was not very uplifting. Many of the information led to the, as I said before, to the cirrhosis issue, and what I did as well was to try to find forums of people having this disease. There is an Spanish association of patients suffering this disease, but there were no many support platforms or platforms of encountering in Spain. I went to different platforms. I prefer don't mention which were that ones. And finally, I went to patients like me, and I asked for enrolling to that platform, reporting about my condition. And at that point in time, I received an email from them saying, you cannot belong to our social network, because not because you are Spanish and this platform is American, but because your condition is not reported. It was so rare that it was not reported. There were no one having this disease at patients like me. So 6 months later, I received an email from them saying that there was a place for me, because there were patients suffering that rare condition, and they invited me to register as a patient, to report my profile, to tell a little bit more about my disease, how I was treated, or how I was being treated, about my age, my style of life, and things like that. And I belong to patients like me. There are right now eight patients like me. I can relate with them. We can share our experiences. All of them have are spending the same living experience with this disease.
So, of course, I have to ask this, Angel. Having been on both sides of the fence, consulting with pharma on how they should engage with social media, and then being a patient yourself, what are the three biggest opportunities you see right now for pharmaceutical companies in Spain to be using social media in an engaging and transparent way with patients?
This is a very good question, Silvia. As you know, the Spanish pharmaceutical industry is facing tough times, very, very tough times, and that is leading to wonder what's going on in the future, because the future will never be the same as the past 15 or 20 years. And this is leading to a change of paradigm. And one of the points to bear in mind is to put the patients, as you evangelize, at the center of the system. To bear in mind that from now on we are dealing with a new kind of patients that are capable to connect each other, patients that are capable to connect in an empowered format with their doctors, and patients that can collaborate with them at the system in prevention and treatment. And that means that pharmaceutical companies should consider that issue in order to help to foster that conversation.